Hi, I'm not Martin, but I like to sound like him sometimes. The autonomic nervous system is really important. It is key to understanding a whole bunch of different medications. So let's talk about it. So autonomic means independent. So this is the involuntary responses of the body. So um, I like to think of it as kind of the um, life support systems of the Starship Enterprise or other things that are going on automatically. So the autonomic nervous system is divided into two major components, the sympathetic and the parasympathetic. When I was teaching undergrad, they liked to think of them as the snake and the Porsche. The snake was the fight or flight. Oh my God, there's a snake. And the Porsche was the, oh my God, I got away from the snake. I'm in the Porsche. Now what's happening to me? All of my systems are kind of returning to normal. And what are the things that the parasympathetic nervous system might be doing? Many pharmacologic agents that we use are going to stimulate, i.e. be an agonist, or they're going to block, i.e. be an antagonist of either the sympathetic or the parasympathetic nervous system. So the sympathetic nervous system, when you see the snake, you see a tiger, you see something that is going to threaten you, your pupils dilate so that you can see it better. Your bronchi relax and open up so that you can get more oxygen in. Your heartbeat is faster because you're afraid. Your heart is trying to pump more blood out to the periphery. Your digestion kind of shuts down. Your blood vessels, especially your peripheral blood vessels, are going to contract down and keep the blood in the organs and in the muscles. So you're going to have a lot of different things happen. Your sphincters are going to tighten up. You're not going to pee. You're going to contract your sphincters so you don't. Now, you get away from the snake or you get away from the tiger, and what's going to happen? Well, your pupils are going to contract back down, your bronchi are going to constrict down, your heart rate's going to slow, your digestion is going to increase again, your sphincters are a little bit more likely to open up, but especially the bladder itself is going to contract, or the bowels are going to contract, and you're going to have peristalsis. The other thing that's going to happen is your peripheral blood vessels are going to dilate. All of those things are either sympathetic or parasympathetic. And by understanding what the sympathetic and parasympathetic nervous systems do, you can understand a whole bunch of different drugs. So let's talk about sympathetic agonists. These are medicines that stimulate the sympathetic nervous system. The sympathetic nervous system is divided into alpha and beta receptors. And so the drugs may be selective to either alpha or beta, or even subselective to different types of receptors. The beta receptors are divided down into beta 1, beta 2, and beta 3. The alpha receptors are also down in various selective receptors, but we don't usually think about this too much with the exception of tamsulosin, which is a alpha 1A blocker, so that we'll talk about that when we get there. So the sympathetic nervous system, alpha, predominantly alpha receptors are going to be found in the bladder and in the, in the sphincter and in the periphery. So that when you have alpha stimulation, your sphincter is going to contract and your peripheral blood vessels are going to contract. With beta stimulation, beta 1 receptors are in the heart. You have one heart, beta 1. And the heart is going to go faster. Beta 2 is lung. The bronchi are going to open up. And beta 3 are actually found in the bladder. These are a relatively new area where we are using pharmacology to affect them. We know that if we stimulate beta 3 receptors, we can actually relax the bladder a little bit and treat overactive bladder. Now, parasympathetic nervous system, we have not been particularly interested in breaking that down, although we are getting more and more interested. There really are two major types of receptors in the parasympathetic nervous system, the nicotinic and the muscarinic. Most receptors are muscarinic, but some of the very specific, very important ones are nicotinic, And especially when we look at smoking and smoking cessation, these are going to be nicotinic receptors. So the non-specific sympathetic nervous system stimulation is going to be epinephrine. And epinephrine is going to make the heart go faster. It's going to open up the bronchi. It's going to do all sorts of things. Now, when we do more specific sympathetic nervous system stimulation, we're usually going to do a beta-2 agonist. And that's going to stimulate the lungs, and it's basically going to cause the bronchi to open up. So when you have someone with asthma, you have someone with COPD, you have someone that you're trying to improve their oxygenation, you're going to give them a beta-2 receptor agonist, and it's going to open up their lungs. Now, beta-1, we usually will use these predominantly selectively with a beta blocker. And so if you want to slow just the heart rate and not have any impact on the lungs, such as in someone with COPD, you don't really want to cause their bronchi to constrict, which is what would happen if you give them a non-selective beta blocker. You want to give them a beta-1 specific blocker. So beta-3. So beta-3 is a relatively new phenomenon. The agonists that we use to stimulate the bladder receptors that actually end up relaxing the bladder are the beta-3 agonist. Myrbetriq is the example of that, and we'll talk about that more once we get to bladder drugs. An alpha agonist, an alpha stimulator, something that does do this is pseudoephedrine. It constricts nasal blood vessels, but it also constricts the sphincters. This is particularly important if you have somebody that takes pseudoephedrine and also has a tight sphincter, such as a 65-year-old man who has a bit of an enlarged prostate, because that man may actually go into urinary retention and require a catheter. So alpha blockers, what can we do with alpha blockade? Well, we can actually give alpha blockade, which causes relaxation of the blood vessels. Alpha stimulation is going to cause constriction, so alpha blockade is going to relax the blood vessels. And it'll also relax the sphincters. And as noted, tamsulosin is the one we use the most, and that's a 1A specific alpha blocker. The non-specific alpha-1 blockers are the doxazosin, prazosin, those kinds of medicines. All of them should improve the urinary output in somebody with an enlarged prostate. So when you're using alpha blockers to treat hypertension, unfortunately, when you relax the blood vessels, which is essentially what an alpha blocker is going to do, if you stand up quick, that normal constriction that happens in the lower extremities is not going to happen. And so blood is going to pool down in those lower extremities. And unfortunately, a lot of those folks will end up with orthostatic hypotension. So if you are using alpha blockers for hypertension, you need to warn people to get up slowly. This is actually the reason that we don't use them that much, although some of the medicines that we use have a little bit of alpha blocker effect, but we don't usually use a strong alpha blocker for hypertension. Now, again, if the prostate's enlarged, we can actually shrink it down with hormone blockers, or we can actually just try to relax the sphincter a little bit with an alpha blocker. So again, beta blockers, beta blockers are used predominantly to relax the heart and slow the heart down, and thus that will also lower the blood pressure. And so anytime you want to keep the heart from going too fast, after a heart attack, for example, you really don't want the patient to be tachycardic. And so the beta blocker will decrease the heart rate and stop the stress on the heart after a heart attack. The other thing that we sometimes use beta blockers for is heart failure. Interestingly, 25 years ago when I started doing this, beta blockers were considered to be contraindicated in heart failure. Now they're one of two drugs of choice, that along with ACE inhibitors, in people with heart failure because it actually decreases the oxygen need. So it basically relaxes, slows the heart down, and decreases the oxygen need. So again, what do we use beta blockers for? Well, hypertension, to try to lower the blood pressure. They're no longer drugs of choice based on JNC8 and some of the other guidelines, but we do definitely still use them. Heart failure, as noted, post-MI. Interestingly, they'll slow the heart rate down, and so in some patients with anxiety, this is actually a useful treatment or at least an augmentation to treatment. The most common time you'll see this is if someone has a big presentation to do and they get very anxious. Lots of times we'll give them a beta blocker to relax them a little bit. Side effects of beta blockers are exactly what you'd expect, which is a slow heart rate, a low blood pressure. Especially in a non-selective beta blocker, you may end up with some bronchospasm. The other thing is that what kinds of things happen when you get hypoglycemia? Well, you usually get tachycardia, you usually get sweaty. All of these are things that are mediated by the sympathetic nervous system, and if you've blocked the beta effect, you may actually blunt the signs of hypoglycemia. So in a type 1 diabetic on insulin, you are going to be extremely careful with beta blockers, and if you do beta blockers, you're probably going to try to use as selective of a beta blocker as you can. So parasympathetic stimulation, again, we can use it for overactive bladder, and that actually would be a parasympathetic blocker, and to stimulate, we can use something which stimulates the bladder, and also Aricept will also increase parasympathetic. It'll increase acetylcholine and increase the cognition in patients with dementia. So another thing that is involved in stimulating the parasympathetic nervous system, which in fact actually essentially blocks it, is we give a nicotinic receptor agonist, and what it does is it gets into those nicotinic receptors and actually will stop the nicotine from a cigarette from actually getting in them, and it gives it a weaker effect. So Chantix or Varenicline is a common medicine that we use. Bupropion is actually a nicotinic antagonist. There's actually no reason why you can't use Chantix and bupropion together, other than the fact that in studies in which they have been used together, they show no increase in smoking cessation beyond the Varenicline alone. So if somebody's on bupropion for depression, there's no reason why you can't leave them there. On the other hand, you're really not going to get any additional effect by putting them on both. So parasympathetic blockers are called anticholinergics because the acetylcholine is the primary neurotransmitter, and the blockade of that is an anticholinergic. And so the old saw, if you will, of anticholinergics is can't see, can't spit, can't pee, can't defecate. And so those are the common side effects that you're going to see. Medicines that we will use that have strong anticholinergic effects would be things like bladder medicines, overactive bladder medicines. They can cause urinary retention, dry mouth, fast heart. And there's a number of other medicines, including a number of mental health medicines, which have anticholinergic side effects. So just for an example, if you have a woman with COPD and you're trying to open up her bronchi, there's at least two ways using the sympathetic and parasympathetic nervous systems that we could use to open it up. There's a third way, and that is anti-inflammatory using steroids. But to open up her bronchi, we would give a beta-2 agonist, which would stimulate and open up. And we would also give a anticholinergic medicine something like Atrovent, that would actually stop her bronchi from constricting. Anticholinergic. Cholinergic would constrict, so we stop that. So basically, you're putting your foot on the gas and you're taking your foot off the brake, and so you should open up the bronchi in two different ways. I think that sort of gives you a good introduction to the autonomic nervous system. Obviously, we'll continue to talk about it since it is involved in a number of different systems throughout the course.